on this slide here, we're trying to define what narrative therapy is or can be, which again isn't always the easiest task.
No.
We tried to put it in simplest terms here, which I think
yeah. So basically, we said it's a theoretical approach to counseling that uses the client's life story as a therapeutic tool. So your individuals or clients will use their stories to help shape their identity, respond to things that happen to them in their life, and that give their lives meaning and purpose.
I think what makes narrative therapy a little bit different is that it's more question-based. There's a lot more asking questions and being really curious into some of the details that are there. So it kind of uses people's imaginations as well as their memories to really fill in some of the gaps in their stories.
You're more investigative.
Yeah, I always like the comparison to Sherlock Holmes. I mean, it really draws out some of your own therapeutic tools to use in working with clients.
But that's definitely something that attracted me to this theory, is that it takes into account so many schools of thought. It's not necessarily based on one small lens. You have to look at the big picture with just the individual and the culture at large.
Yeah, definitely. And I think that big picture comes from the idea of seeing a person's life as a story or as a text. A lot of what is talked about with narrative therapy is people's lives can be looked at as this story, where there's many different stories that come into play to give people direction, to give people the meaning in their lives. But it all comes from looking at lives as something that can be written, rewritten, authored, and then read.
And interpreted in different ways, because if you remember your high school English classes, you would be assigned a text or a book, and everyone would have something different to say about what it meant, what the themes were, what they got out of it. So that's what's important to explore with your clients, is what meaning did they make from the event that they're talking about.
In our roles as therapists, counselors, because I think a lot of the dominant story is what narrative therapists would call a problem-saturated story. So you have clients that come in to see you as a therapist. You have children who are brought to you to work. There's always this story that accompanies them, and usually it's the reason for referral. So if you're doing an intake, if you're taking down someone's information, it's usually problem-focused. So the terminology is problem-saturated story. It doesn't account for all of the other aspects of a person's life. It's just the problems.
And I know what I like, part of our intake here, or at least, when you get a client and you're talking with the parent, it asks about their strengths, their likes, and often the parents are so wrapped up in this problem that they haven't even considered those other parts of their child, and they might take a second and pause and be like, you know what, I really don't know.
Yeah.
And that's important too, because anybody isn't just, we'll get into this later, but that doesn't define the person. It's just a part of the person or something acting on the person. And I like to draw out in parents the things that they do like about their child and the things that are going well, and highlight those victories, because that's going to lead to hope and empowerment too. Externalizing the problem. So when I first started learning about the process of narrative, this concept radically shifted how I viewed my clients. And it's so simple, and it's just kind of just tweaking your train of thought just slightly, but to view the person not being the problem, but the problem is the problem, gives so much hope to people. It means that their identity is not immersed in this diagnosis or these problems that are going on with them.
It makes it so that the client becomes the observer and isn't just the observed. So it's not us as therapists identifying their problems as them or trying to give them the criteria that represents the problem and labeling it as something that is them. We're saying, no, let's push this as a third party in the room so that you can also take it outside of you to look at it, to examine it, to figure out how it works and how you can work with or without it.